So using a combination of all these procedures, we can give you what is these days very popularly known as a designer vagina. Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Cosmetic Clinic, Saket. Today in this video, we're going to be talking about labiaplasty. This is a procedure which is less discussed on any platform, but is sought by both girls and women. So today, first let's discuss about what is labiaplasty. Labiaplasty is a procedure which reduces the size of the lips of the vagina. In medical terms, this is known as labia minora reduction. So let's discuss about who requires the labiaplasty. Labiaplasty is a procedure which is most commonly performed in women after childbirth. What happens is during pregnancy, due to hormonal changes, there is an increase in the size of the labia. Also, the color of the labia becomes darker than it originally was. This can regress to a certain extent after childbirth, but some increase in the size always remains even after a couple of years after childbirth. So most commonly, this procedure is asked for by women who have completed their families and have 1 or 2 children. However, in certain cases, an enlarged labia can also be found in young girls. So I would say about 80% of the women are going to be people who have had children, but 20% of people requiring these procedures can also be young girls. So why do we perform a labiaplasty? An increase in the size of the labia causes discomfort in wearing certain clothes and undergarments, and women usually complain of friction and irritation when they're wearing, say, a tight legging or a tight jegging. This is the most common reason for which a woman wants a labiaplasty. Along with that, some people also have asymmetrical labia. So one labia might be larger than the other, and this can be corrected during a labiaplasty procedure. Thirdly, a common issue is the change in color of the labia, especially after childbirth. So women usually request that the darker looking labia is unappealing to them and should be removed. The fourth reason is hygiene. So with an enlarged labia, there could be a chronic discharge and irritation for the patient, and performing a labiaplasty corrects these issues. Last but not the least, large labia can also cause discomfort during sexual intercourse, so it is also a part of the sexual well-being of the woman. Labiaplasty can be performed under spinal anesthesia, or if the woman is too apprehensive, we can also give a general anesthesia to the patient. This is a short duration procedure, takes about 35 to 40 minutes. In some cases, this is also combined with other forms of genital surgeries, say a fat grafting into the labia majora or a vaginal tightening. So in that case, the combination of procedure may take 2 to 2.5 hours. This is a surgery which is a daycare surgery, meaning thereby that the patient is discharged on the same day. There is no period of bed rest or, say, restriction of activities which is mentioned after labiaplasty. And usually the patient is fit to resume her activities, say, the next day. So if a patient is going to the office or she's a working lady, she can resume her office activities. And if there are any household chores to be performed or general routine can easily be followed even on day 2 following a labiaplasty. The pain associated with the labiaplasty can easily be managed with oral analgesics, and usually after 3 to 4 days, the patient is quite comfortable. One advice we give to the patient is to wear loose-fitting clothes so that there is no friction and nothing rubs against the stitch lines. Also, one of the most common sequelae of any genital procedure, including labiaplasty, is an increase in the discharge. So the patient might experience an increased discharge for a period of about 2 weeks, which is nothing to worry about and usually resolves on its own. The important thing to understand is that this is not the kind of procedure which requires a bed rest or which requires a break from work. If you're a working woman, you can, say, resume office by day 3. And if you're a housewife, you can do all your chores by day 2 to day 3. So you don't need to schedule the surgery in such a way that you have a lot of leaves. This is a very short and quick recovery procedure. Let's also discuss the risk associated with this procedure. So it's very important that the labiaplasty is done by somebody who's experienced in the right technique. We've also come across patients who've undergone this procedure by less trained people, where simply the tissue has been removed haphazardly and there is no technique to it. What can happen if this is done is that the patient might have a large amount of tissue which has been removed, which can lead to an unsightly appearance. It can also lead to discomfort during sex because of excessive tissue having been removed. Also, there are some very sensitive nerve endings in that area. So if somebody has not really taken care of the anatomy of the region, the nerve supply of the region, the patient can have constant pain in that area. So although it's a very simple procedure, it has to be performed by a trained surgeon who knows the intricacies of that area, because as we know, tissue in that area is extremely delicate, it's extremely sensitive. So it's very important that you go to a person who knows how to do this procedure well. Performed in safe hands, this is a very safe procedure. Every patient is happy with the results. There might be an initial period of swelling for about, say, maybe 2 weeks, because this area is very rich in its blood supply. But after about 2 weeks, everything is fine. The patient is essentially pain-free, and the labia now has a much better improved aesthetic appearance. Also, the symptoms of friction or irritation or being unable to wear tight clothing, all these are taken care of within a period of recovery of just about 3 weeks to a month's time. I hope this video has answered most of your questions regarding labiaplasty. One thing I would like to add is that labiaplasty can be combined with a whole spectrum of genital rejuvenation procedures, including fat grafting into the vulva. It can also be combined with the vaginal tightening, and in some cases, something known as a clitoral hood reduction. So, using a combination of all these procedures, we can give you what is these days very popularly known as a designer vagina. I hope you found this video useful. If you have any further questions regarding labiaplasty, do drop them in the comment section below. Also, if you like this video, please share it with your friends and do subscribe to our YouTube channel for more such informative videos.